Hello everybody, thank you very much for joining me this afternoon. This is continuing our series on discussion of elderly cats, and today we're going to talk about a condition called cognitive dysfunction syndrome, or CDS for short. As usual, if you'd like a copy of the slides that I'm using, please feel free to request them by email and we'll send those to you, no problem. So what is CDS? It's a bit of a mouthful to say, so I probably will for most of this talk just abbreviate it to those three letters. Well, I think the easiest way of thinking about this is that it is the cat equivalent of Alzheimer's disease. And there are indeed very many similarities in our current understanding and our current knowledge of both what causes CDS in cats and also what it looks like under the microscope. Because at the moment, I think similar also to the situation in human medicine, really to get a definitive diagnosis of this, you actually need to look at the brain microscopically. Oopsie, I've just, yes, gone quiet again. Sorry, I just thought I might need to mute someone there. There are some similarities, there are some differences though, so they're not identical conditions, and Alzheimer's really should only be used to describe the situation in people. So CDS is the cat equivalent. And the sorts of current hypotheses for why this develops, again, overlap with our understanding of human medicine, where age-related changes, damage essentially caused in the brain contributes to deterioration in mental function, and that can be because of small bleeds within the brain, also little blockages in blood vessels, what we would call an infarct, where blood flow is damaged, or where blood flow is just not as good as it should be. So we have what we call hypoxia, a lack of oxygen, and damage to the tissues that means that they just aren't working as effectively. And under the microscope, there are definitely some similarities in what we would see in a cat brain and also a person's brain if affected by these conditions. And indeed, I've just borrowed these images from a publication which I've referenced on this slide to show you some examples of, on a scan, actually some of the changes that you can appreciate. So we've got on the left-hand side a normal aged human, and then below their scan, we've got someone suffering from Alzheimer's disease. And you can see how the outer layer of the brain is much thinner and more crinkly, would be my very non-technical description there. And some similarities in the cat and also the dog brains as well, in terms of normal cats and normal dogs compared to those affected by cognitive dysfunction. So there are some similarities in terms of our understanding of how this condition arises, and there are some similarities beyond that as well. So the next similarity really would be that this is, as is the case with Alzheimer's in people, the older you get as a cat, the higher your risk of developing this condition is. So it's estimated to affect more than a quarter. Sorry, just to see if I need to mute anyone. Just one sec. So it is estimated to affect more than a quarter of senior cats. That's cats aged between 11 and 14, and actually at least half of super senior cats. These are cats aged 15 years and over. And I've included again this lovely chart from International Cat Care, which I think is really great for a number of reasons. One of those reasons being that, as well as the cat age that you can see in that sort of middle column, on the right hand side you can see a human equivalent age, and so you can see the sort of equivalent ages that we're talking about in people. For a 15-year-old cat would be a 76-year-old person, and of course we know that cognitive changes are quite common in people of that sort of age as well. So what sort of clues of CDS might you be able to spot as a carer? Well, there is an acronym that's actually more frequently used in dogs than in cats, but I have included it here in case it is helpful. Sometimes, you know, these little reminders can be a useful way of thinking about conditions. So we have this acronym DISHA, D-I-S-H-A. The D is for disorientation. So this would be the cat that feels a little bit or behaves a bit like they're confused confused. They can't quite remember where is my litter box, or where is the back door, just not seeming quite as mentally agile as in previous years. The I is for altered interactions, and that's interactions not only with people in the household, but also with other animals in the household. And we'll talk a bit more about what those sort of changes might be as we go through. Altered sleep cycles as well. So often cats with CDS will maybe more awake in the night, having slept solidly all through the day, not very convenient for our sleep patterns. And they tend to sleep more. So that might be something else that we pick up. House soiling is the H. So toileting accidents, unfortunately, quite commonly associated with this problem. And again, probably link into forgetfulness in terms of where the toilet facilities are, and also perhaps not getting there in time, therefore, and having an accident. And then the last letter, the A, altered activity, restlessness, or decreased activity, changes in activity levels. So changes in behaviour, essentially, that you might see. Other signs often reported, particularly in cats, would be changes to grooming behaviour, and often that is a reduction, but not always. Also, the cats may have altered reactions to stimuli, so they may appear to be either a bit jumpy, a bit irritable, a bit anxious, or perhaps even less responsive. That can vary. And increased vocalization is very common. So probably anyone who has had an older cat will have experienced this increased vocalization. The older cats tend to be more chatty, but also have this quite often this vocalizing at night, which is not always very easy to live with, and can be a manifestation of CDS, but also of other conditions as well. It's not the only condition where we will see an increase in vocalization. This slide just shows some of the possible frequencies that we might see some of these changes. And I say possible because actually this is really just cumulative data from behaviour referrals where people were seeking advice. So actually in this, I think the data on this slide is from people wanting advice rather than necessarily taking their cat for a referral to a behaviourist, but gives you an indication of the frequency and the sort of common changes. And again, not all of these actually will have had confirmed CDS because we need to rule out other causes, but it's very likely, given the age range of the cats reported here, that many of these cats did have cognitive dysfunction, and therefore the house soiling, the vocalization, the wandering, all those other things that are listed here were most likely a feature of that condition. And many of you listening will have known that Vet Professionals does a number of surveys, and we're often, very often, I'm afraid, asking for your help in terms of answering some of the questions that we have and that collaborators of ours have about cats. And I would like to say, before I go any further, thank you so much to all of you who have contributed to our surveys. The data that we get is just so brilliant. It really is such great quality. I'm currently going through the Happy Cats stress associated with the visit to a vet clinic data, and it's just brilliant data that you've submitted for that. So thank you for that. But on this slide, actually referencing an older survey, was actually, I think, possibly the first survey that we put up on the Vet Professionals website. And we wanted to look at behaviour and health changes in older cats, and also to compare it to some data from a very famous UK cat behaviourist called Vicky Halls, who probably many of you also will have heard of or may know. And we wanted to look at what changes had happened over time. And I'm delighted to say that this was a really huge study and very difficult to write up, but actually it was published this month, so July 2020, and it's a free to access paper. So actually I've put a screenshot here. If you have any difficulty finding it online, feel free to email us and we can send you a copy, but it is open access to anyone. You don't need to subscribe to the journal. And it documents in much greater detail than I will now, the sorts of changes that we've been able to document through these surveys. The Vet Professionals one was up on the website for several years, as you can see, 2010 to 2015, and we had almost 1,000 owners participate in this study, and the data that you have submitted is now reported in great detail in this paper, so that may be of interest to you. And I just wanted to highlight some of the things that were found, really to give you an idea of what's common in older cats. And whilst, you know, we didn't examine the cats whose data was reported in this study, it was all came from owners completing online surveys. So we can't really infer too much about the individual cat's health status, but we can say with some confidence how common changes are in older cats. And some of those changes will be due to cognitive dysfunction. So, for example, just looking at some of the sort of headline data, appetite, well, appetite changes were reported. About a quarter of cats were eating less than when they were younger. All of the questions asked really the owners to compared to when your cat was younger. How are things now? About a quarter eating less, and a little bit smaller number than that eating more. Those are probably the hypothyroid cats and cats with other diseases that can increase appetite, but hypothyroidism would be a big contender. Probably not a surprise to hear that more often in terms of thirst changes was drinking more. Many cats with thyroid problems, diabetes, kidney disease, all common old cat diseases will have an increase in thirst, so that is probably reflecting that. Time spent grooming, this is where perhaps cognitive dysfunction may have had an impact. A reduction in grooming was most often. So some cats were grooming a bit more, but 35% of cats, you can see, reported to be grooming less often, which is often the case in cats with CDS. Sleeping more as well, 70% of cats reported to be sleeping more. A smaller number spending less time sleeping. Again, those cats may well have had hypothyroidism. That tends to make you more jittery and more wakeful. Time spent outdoors, well, again, this data is probably not going to really surprise you, but many cats spending less time outdoors than they had in their youth. And it was great to see, actually, again, it really reflects the fact that the people that participate in our surveys are really wonderful carers of cats, because I was just absolutely thrilled to see that more than 80% of these older cats had access to a litter box. And that's in spite of the fact of many of these cats, because it's a UK-based survey, in all likelihood having free access outdoors. But brilliantly, they were being offered a litter box as an option, which I think is the kindest approach. But in spite of that, actually, toileting accidents quite common. And again, that probably fits with cognitive dysfunction as a sort of #1 contender. Social interactions, well, this does vary. So just under 20% were recorded as being more intolerant, so less interactive, a bit more withdrawn, whereas 13% seemed to be more sociable as they'd got older. And social interactions with people, more often actually the cats were reported to be more affectionate, a bit more clingy, so 35% in that category. Increased vocalization, very common, so we've already mentioned that, and nighttime vocalization increased in nearly half of the cats, so that was a really common finding. And we'll come back to nighttime vocalization because it can be so challenging to live with as a carer, and there are some strategies that can help with that, so I will come back to that towards the end. So thanks to your participation in the research that we do, and thanks to Vicky Hall's research as well, we do know that it is very common as cats get older that they do often develop behavioural or their behaviour changes and their lifestyle changes. And of course, as carers, what we want to do is just make sure that we're there to support any changes that need or would benefit from our support. And so really a message more for my veterinary colleagues and my nursing colleagues would be that we do want to pay more attention to behaviour in our older pets, and not just ignore things and put it down to old age and not really investigate any more than that. We want to really keep tabs on what's happening and make sure that we are there to step in and support and help cats where that looks like it would be helpful. I may have shown you this screenshots of my questionnaire before, but if not, this is a resource that I often mention to my veterinary and vet nursing colleagues as a questionnaire that I've developed over the years to really remind me what I need to discuss with carers when I see them with their cat. And this is freely accessible on the website in the free download section in the vet part of the cat articles, and it's called Health Questionnaire and Checklist for Elderly Cats, and it includes a reminder of what sort of health changes to look for in all cats actually, so changes in appetite, changes in breathing, all sorts of things there, but also what's in the mobility section on the right hand side may be a little bit small for you to read on this screen, but you will be able to read it properly if you download it, are questions that often actually come down to behaviour and lifestyle. And whilst that's very useful, as we talked about in the previous session, in finding cats that have perhaps signs of chronic pain due to osteoarthritis, it's also useful for finding cats that perhaps are struggling with cognitive problems as well. So for example, if the cat is grumpy or withdrawn, has altered relationships, that's also included in that questionnaire as well. So if we're concerned about this as a carer, and I would encourage you, if you are concerned, to definitely speak with your vet about it, what next steps are likely to be discussed with you? Well, firstly, of course, as always, your vet would want to examine your cat and look for clues of any illness that might explain whatever you've brought in as a concern. And cognitive dysfunction is a diagnosis of exclusion. We need to really rule out everything else, but also there are lots of things that can have overlapping clinical signs. So for example, nighttime vocalization, cognitive dysfunction is one possibility, hypothyroidism and high blood pressure are other possibilities. So important to have that vet exam to look for other clues. For example, in a cat with hypothyroidism, there may be an enlarged thyroid which can be felt. A goiter is an enlarged thyroid which we can feel just by feeling the cat's neck. There may be a fast heart rate, a heart murmur, what we call a gallop rhythm as well, listening to the heart, all these little clues. And so the veterinary examination is undoubtedly very, very helpful and very important. In addition to looking for those clues of other diseases, we might see that a cat with cognitive dysfunction may be a bit anxious or a bit grumpy, a bit irritable. But again, there are other things that can affect that as well. If a cat's in pain because of arthritis, it's likely to be grumpy. So we need to have a good look at the cats. And as I've mentioned, there isn't really a way of diagnosing or confirming absolutely with certainty that a cat has CDS unless we unfortunately look at their brain, which we can't do ante-mortem, we can't do before death. So clearly it's not on our diagnostic repertoire, but instead we rule out the, other things as best as we can in individual circumstances, and come to a conclusion that it's likely to be present. And again, the older the cat, the more likely they are to have some evidence of CDS, even if it's not their only problem. So this is just another really listy slide of some of the other conditions that we need to consider. And it really depends a bit what behavioural change your cat is showing as to which of these might be a possibility. So for example, and apologies for putting in lots of little acronyms here as well, but LUTD is lower urinary tract disease. A cat that's having toileting accidents involving urine, it's really important to check, obviously, for things like cystitis, which is inflammation of the bladder, one of the diagnoses that would fall under that lower urinary tract disease bracket. So that would be one example why that's there. Behavioural changes may be because, excuse me, of infections affecting the brain and CNS, central nervous system. Brain tumours also are quite common in older cats and often very slowly progressive as well. Chronic pain, I've already mentioned. Osteoarthritis, that's the OA acronym, can be a cause of grumpiness and the cat being more withdrawn and having altered relationships, more time sleeping. So it does really depend on the individual as to perhaps which of this long list, and there actually are more things that I've not included on this list that we might need to consider as a vet, and that will depend a little bit on your cat and their situation. So potentially quite a long, what I would call a shopping list of things that as a clinician I would want to do to really try and do the best for any patient with these sorts of problems reported. I want to obviously have the full history from you. So what exactly have you seen, and what clues can we gather of any other concurrent illnesses that the cat may be suffering from. When I examine the cat, I definitely am going to want to assess blood pressure, because we know that high blood pressure is common, also that it's treatable. So it's one of those good things, if you like, to find in an older cat. And there's a whole series of Cat Cafe presentations on hypertension, which I think were recorded in May, but you can see them on the website if you weren't able to attend those. Mobility assessment relevant to osteoarthritis, which I think we talked about last week. Feeling for that thyroid, which is what I'm doing in that top photo, feeling the neck very carefully for an enlarged thyroid. Listening to the heart for those clues of hypothyroidism, like that fast heart rate, the heart murmur, gallop rhythm, etc., etc. So that would be my clinical checklist. And then from a next steps, ideally, if possible, I would want to do certainly some blood and urine tests to again rule out possibilities like hypothyroidism. Also, some urinary infections in cats and in people can affect your brain function. You will sometimes have signs of confusion and dementia, particularly with some E. coli infections, and not always associated with lower urinary tract signs. So even if the cat's not got obvious signs of cystitis, I would always like to do a urine culture, particularly if the signs of dementia have been quite sudden in onset, quite a recent and new and severe finding. Infectious disease testing, that's the serology side of things. FELV, feline leukemia virus, FIV, feline immunodeficiency virus, and FIP, feline infectious peritonitis. These are all things which I think don't necessarily need to be tested in every case, but it very much depends on the other clues that are present, and that might be the sort of thing that's mentioned to you depending on your individual cat's situation. For example, FIV might be relevant if your cat has been a stray that has been in lots and lots of fights before they were neutered, and perhaps has had a history of abscesses and other infections, then that could have a relevance on their brain function as well if that subsequently deteriorates. And then beyond that, there are a whole host of other investigations that again might be needed. So definitely not all of these, in fact often none of these, but included for completeness, really depending on where the evidence is sitting, really might be an indication to do, for example, if neurological findings are asymmetrical, so bad on one side and not bad on the other side, that might point to a brain tumor or a brain lesion, and imaging the brain using CT or MRI scanning might be helpful. But it really does depend on the individual as to which of these might be needed. CSF, sorry again for the acronyms, is cerebrospinal fluid. So once we've made a diagnosis, which as I've said is generally to look at the age of the cat, how it has presented in terms of the behavioural changes, and having ruled out, really important to rule out all the treatable things that we can sort out, having done that to the best of our abilities. If we are left with a clinical diagnosis of CDS, then we move into management. And often actually many cats with CDS, because they're older, they do tend to have other issues as well. So hence mentioning comorbidities, other illnesses. So often the cat may have some arthritis, or they may have some kidney disease as well. And so we're trying to manage often quite a complicated and moving situation, but important to remember, from my perspective as a clinician, to remember all of the cat's different problems so that we hopefully do the best job in terms of providing a plan or recommending a plan that will hopefully help them. In terms of CDS itself, it probably won't come as a surprise to hear that firstly, we don't have a treatment, a cure for this at the moment in cats, and that it will get worse with time. And the rate of progression is quite variable, which again probably just reflects the fact that we don't at this stage know as much about this and what causes it as we would like. But there are lots of things that we can do to improve quality of life, and those broadly fit into the categories of environmental enrichment, nutritional support and supplements, where there is also a little bit of data to support, and for some cases perhaps some medical support as well. So that's what we'll finish off by going through. In terms of environmental enrichment, the ideal really is for all of our cats to have an enriched, fun environment that's stress-free to live in, and the equivalent of ourselves doing Sudoku and crosswords is to really keep our cats' mental agility active into their older life by encouraging play and encouraging activity with them, and starting that when they're young, so that doesn't come as a sudden shock to do it when they're older, but basically having life as exciting as possible. So examples of ways to do this will vary a bit according to your household setup and whether your cats go outside, for example. A lot of cats that are allowed access outside, that of course is an amazingly enriched world typically for them to go into. But if they're inside, having windowsills that are low and easy for the cat to still look outside and have all that interaction there can be one way of providing a more enriched environment. From a food perspective, I put just one example of what we often call puzzle feeders. So this is a sort of simulated mouse that you can put dry bits of cat food into if your cat likes dry food or dry treats, and then they have to play with the mouse to knock the food out of it. That's the Doc and Phoebe system, which I think is quite popular, but there are a lot of other options as well. And indeed, you can do lots of homemade options as well in terms of sticking together used cardboard loo rolls, for example, into a pyramid, and having little treats and things to fish out of there. It's important to make sure that the environment does provide all of the cat's needs. So it has certain key resources, which I put on this slide, that it needs to have accessible to it. So if it has difficult mobility or dementia that might affect remembering where things are, then it's making sure that these things are all freely accessible in whatever environment the cat frequents. And your older cat that does suffer from dementia might have quite a small world that it is using by then. So you just need to make sure they've got access to all the things that they need, that they feel safe and stimulated, as long as that's not a negative thing for them. So having some time with you, having some play, etc. So if your cat likes catnip, the catnip toys can be quite helpful. Again, the little puzzle feeders, all these sorts of things can be helpful. And I've mentioned in a previous discussion about house soiling and toileting accidents, what is considered optimum for toileting facilities for cats. But just a reminder here that obviously with our elderly cat that perhaps has a poor memory, perhaps has lost some of their learnt behaviour, so therefore might not be as inclined to use a litter box, just try and make it as close to what a cat would choose as their ideal as possible. And our current knowledge suggests that cats tend to prefer a fine, sandy consistency of cat litter, and a clumping litter is good because it means we can see what's been passed and we can keep it clean very easily as well. So just some reminders here on that ideal toilet facility, what that might involve. If your cat is very badly affected with their cognitive function and really struggling, then they might find life very challenging. And in that situation, one thing that can help is to even just contract their world a little bit more. So perhaps if there is a quiet room in your home where, particularly when you're not there to be of some reassurance to your cat, if you have to go to work, for example, the cat can have maybe a spare room or a quiet room where everything that it needs is visible, so it doesn't again have to think, where is the toilet? It can literally just look around, oh yes, it's there, and there's my food bowl, and that can help in terms of reassuring the cat that is particularly anxious. The Feliway Classic diffuser, which is the synthetic facial pheromone diffuser, helps to provide some reassurance as well. So the cats will, the chemical signal signaling that achieves will help your cat to feel more reassured. Some behaviourists also are fans of a product called Pet Remedy, which I included a picture here as well. This contains various I think herbs and essential oils. Valerian is certainly in there, and there's some data to show that that is quite helpful in terms of sleep in some species. I think there is more data in people and dogs than there is in cats, but it might be something that is worth a try, just in terms of, again, providing that reassuring environment. And there are also some nutritional supplements that you may have come across that do have some impact on anti-anxiety impact. So they're not drugs. You can get them without any sort of prescription, and they are completely safe, but they do actually interact with some of the receptors, like the GABA receptor, that again can help you feel sort of relaxed and calm, and they have been reported to have some impacts in some studies in cats as well. So alpha casosapine is a milk hydrolysate, a milk protein, and Zilkine would be one of the brands that is available for that. Also, Royal Canin do a diet called Calm, which has L-tryptophan in, so that might be another way of administering it. L-theanine is another supplement that you can, all of these are pretty freely accessible. What about diet and cognitive dysfunction? Well, there has been a lot of interest in diet, and actually several of the pet food companies have done studies, more in dogs than in cats, but in terms of cats, actually Purina, the company, has probably done the most research looking at the impact of diet on cognitive function. And I think the bottom line, as I've put in this box on the right, is that actually there is some evidence, particularly strong in dogs, but I think also some evidence in cats, that a high quality diet that has plenty of antioxidants in it actually is beneficial for our pets, and it's beneficial to their brain function, but also likely supports their joint function and general health in other ways. So probably in terms of general advice, I would say just use as high a quality a diet as you feel able to provide for your cat. A senior diet is likely to be more supplemented in these sort of antioxidants and substances, the fatty acids, etc., that I've included in here, that have all been looked at. And whilst there is not really strong evidence of their benefit in cats, there is some evidence of benefit, and this is probably an area that is going to continue to develop in the future. And some of these papers actually on this slide, in the brackets there, these are studies that I think they're all of the ones here, I think, are Purina funded studies. So it is definitely an area of interest for pet food companies to provide more support. You can get separate supplements that are very much the same sorts of things, but provided as a capsule. And there's not so much actual research that's been done on these supplements in cats. Again, more has been done in dogs, and some of them have definitely been shown to be of some benefit to dog cognitive function. But just one bottom line message here is just not to use the dog products in a cat. Not that you probably ever would think of doing so, but there is one of the substances often used in the dog products is something called alpha lipoic acid, and that actually is toxic to cats. So just don't, if someone gives you their dog products, yeah, don't use it in your cat. Beyond that, there aren't any authorised medications for CDS in cats. There are some that have been authorised in dogs, and there are some that have been used in dogs, but not a lot. Well, there's really no data for cats, and to be honest, I've not used any of these in cats, but there are some products that have been mentioned, and I've just put some of the active ingredient names there in case that's of interest to you. But my approach really has been primarily to focus on the environment, behavioural support, for specific support of individual cats beyond that, if anxiety is a feature. But I have not used some of these other products that are licensed for dogs or for people. So finally, just wanted to mention the nighttime vocalization, because anyone who's had a cat yowling in the middle of the night will know this can be very challenging to deal with, and it can actually be quite distressing as well. The cats affected by this will potentially wake you up with this very distressed sounding yowling in the night, and probably most of us, when that happens, we're so well trained by our cats that we'll leap out of bed to minister to whatever need we think they might have. And often they don't really need anything, but this is one of the potential symptoms that can be seen with cognitive dysfunction. And as time goes on, it actually can be really difficult for carers to live with and completely exhausting. So if any of you have had to live with a cat with this severe nighttime vocalization, you will definitely know what I'm talking about. This is a chart from actually the Vicky Hall's data, which was part of the data reported in the paper I mentioned at the very start. And it just shows on the y-axis, the up axis is the number of cats or the proportion of cats that were vocalizing at night. And then we've got it by age group. So you can see there are quite a lot of cats at 0 age, which were vocalizing at night. These are basically the cats that have always vocalized at night. It didn't change at all through their life as far as this survey was concerned. It just was always something that they had done. So some cats just are very chatty. But what you can see with the other bars here is that as the cats get older, typically we're looking at 10, 11, 12, you know, there is a big increase in the ones that then start to vocalize at night. And it only really drops off because there are fewer numbers of cats in the very elderly age brackets. So it is certainly very common, and I think, as I mentioned, this study most recently studied the 45% of cats were vocalizing more at night, the older cats. So before we assume it's cognitive dysfunction as vets, we definitely need to rule out other possible causes of it. So this is just a reminder of those. I think one I didn't mention was deafness, but that can be another reason of shouting, if you like, in the middle of the night. But checking blood pressure, checking for hypothyroidism, both strongly recommended because those are treatable causes of nighttime vocalization. But if we've managed to rule all those things out, then what more can we do? And the current recommendations would include, firstly, trying to have, you know, if you can, wear your cat out a little bit in the daytime. So encouraging interaction in the daytime. I don't mean really disturbing your cat or distressing your cat, but just if there is any way you can sort of tweak or encourage their sleep-wake cycle so they're a bit more active in the day, that's probably a good thing. But the other advice, which is really geared towards protecting the carer and ensuring that the carer can get their sleep and therefore be the best carer that they can possibly be, is to have a separate cat room for bedtime and create a bedtime routine for the cat that is vocalizing at night. And this is something that involves creating a zone where the cat has all its resources. So this might be, again, something that their room that the cat goes into in the daytime when you're not there, if they are particularly severely affected and you think they might be distressed when you're not at home. All of the resources are available. You've got your Feliway and your pet remedy plugged in, so it's hopefully as calm and reassuring an environment as possible. And then what changes is that when you go to bed, you take your cat to this room and perhaps give them a little nightcap equivalent, so a little treat of some sort of description, the equivalent of their sort of treat and their bedtime story, bedtime cuddle if you like, and then you leave them in that room, you shut the door. And the most important thing is you do not open that door until the morning. So, of course, if you are suffering at the moment with a cat that is waking up in the night, vocalizing, that last bit might be very difficult. And some people really don't feel that they can go through with this because they feel cruel to the cat. So that's something you have to reconcile with yourself. What I would say is I think you need to look after yourself. And if you're caring for a cat and it really is destroying your sleep, you can't be a good carer to your cat. You need to look after yourself. So where I have had to deal with this situation, I have suggested that perhaps if there are 2 people in the house or more, then the person that is perhaps least bonded to the cat or sleeps the deepest perhaps is the person who manages this. Sorry, I think we've got someone on mute. Let me just sort that out, sorry. So the person who is least bonded to the cat or sleeps the deepest, does this, and perhaps the other person who is worrying about it spends a night or two with a friend or relative, because usually what happens is actually even cats with quite severe cognitive impairment will actually learn very quickly, oh, when the door is shut, the door is shut, and when it opens I can come out, but I'm just in my zone now, I'm in my bubble. And so within a night or two, often the cat stops the loud vocalizing at night, and you can get your sleep, and the cat is fine. And I don't think it's a cruel thing to do. I think it is a way of protecting yourself, but I understand it can be actually difficult to do, particularly that first night. So I hope that's of some help. I think the challenges with cognitive dysfunction in cats are awareness of it as something that exists, not ignoring behavioural changes in older cats, because also whilst we can do some things for cats with cognitive dysfunction, we can do even more if we diagnose some of these other treatable conditions. So I think always speak to your vet clinic if you see a change in your cat, and take their advice, because there may well be plenty of things that you can do to support your cat and help it in its elderly years. And even if the diagnosis is cognitive dysfunction alone, I still think we can do a lot to really provide reassurance and improve quality of life in severely affected cats. So there are, as usual, some resources on the website, that just a reminder of where to find those. The Elderly Cat book was co-written with Vicky Halls, the behaviourist I mentioned. So there's a lot of behaviour in this book, and a lot about care of healthy elderly cats, as well as information on diseases and behavioural issues as cats get older as well. So you may find that a useful resource. And next week we have the final session in our Senior Cat series, which is about preventative healthcare of older cats, what's recommended and why. So I think it's the final piece of that jigsaw puzzle in terms of providing optimal care, my suggestions and recommendations for how to achieve that. So I hope you'll be able to join me for that session. But thank you again for listening to today's session, and I will be delighted to answer any questions or hear any comments that you have. Thank you very, very much.